without further delay, let's dive into the virtual sea of knowledge and exploration. So, greetings and a virtual warm welcome to everyone joining us from various concerns of the digital realm. Thank you for joining us for the today's webinar. So, let me introduce myself. I'm Kalai Selvi. I'm the event coordinator at Texila American University. Today, we are going to discuss about the topic global opportunities unlocking your path to medical practice in India and in the US. I'm glad to introduce the speaker of the day, Mr. Syam Kumar, Chief Executive Officer in Texila American University, Guyana. So, Mr. Kumar brings more than 20 years of experience in the international higher education and offshore medical school sector. He was instrumental in establishing of multiple Caribbean medical schools and served in various capacities, including as a chief financial officer and vice president. In his early career days, he also worked with the Bank of America and a business analyst in the wealth and investment management team. Sham's experience in higher education includes finance, administrations, and operations. Mr. Kumar completed his MS from Texas and AM University, USA, and MBA from Bardiyar University, India. He is also certified accreditation compliance officer from the Distance Education and Training Council, USA. Today he is here to present on the topic global opportunities unlocking your path to medical practice in India and the US. We welcome you, sir. Over to you.
Thank you, Kalai, for the wonderful introduction. Good afternoon, good evening, and good morning if anybody is joining from this part of the world. My name is Syam Kumar. I'm the CEO of Texila American University. This webinar is a part of a series that we have launched to give anybody more information on higher education, especially relating to medical education. This is an ongoing series. We at least have once in a month event, once in a month series of webinars that happen. So if you have joined any previous webinar or if you plan to join any future webinar, we always try to bring in something new. So this specific presentation, we will focus more on the medical education program in US and also in India, the licensing requirements basically, and then we'll give you an overview of the structure of our program also. And in the upcoming sessions, we'll talk more about specific licensing requirements in US and Canada and how we cater to some of those requirements, etc. So what I'm trying to say is if you've been a part of a previous webinar, we always try to bring in something new and new information. So please feel free to join any of your future webinars also, which happens at least once in a month. If you go to our website, there is information when is the next session. So join, you can register for it, and so that you can be a part of all our info sessions and webinars also. So with that said, I will get started with my presentation. I'm going to share my screen. So this is a brief overview of what we are going to talk about in today's webinar. World Health Organization recommended physician requirement. What is the number of physicians per patient suggested by World Health Organization? How does many countries in the world stand against the recommended number of physicians in the world? We will focus specifically on physician shortage in the US. After that, we'll talk about medical education in the USA and Caribbean and how foreign medical graduates are meeting this demand. And what are the key points key takeaways that you should have in your mind as an individual, as a student who is exploring medical education abroad based on the information that is given above. And then medical education in India. And that's a very brief and short discussion on India because most of you know how the medical education system works in India. Then NMC regulations and how, if anybody is looking at an opportunity or exploring foreign medical education, what are some of the considerations that you should have in your mind? And then we'll open for questions. The presentation can run for around 30 minutes. And after that, we'll have a question and answer session for 20 to 30 minutes with a few minutes here and there. So save your questions towards end. You can ask your questions by raising your hand, or even you can put messages in the group and we'll take questions one by one. The physician shortage across the world is not something new that has come across our way. Now, World Health Organization recommends at least one physician per 1,000 population, one physician per 1,000 people. This, according to World Health Organization, is the very minimal, the least that can be expected. But definitely there are developed countries that expects much more. For example, USA even now stands at around 3 physicians per 1,000 people, but they are still expecting a huge deficit in the physician population in the coming years. So we'll talk about more of that in detail. This is just a graphical representation of countries that have at least a slightly higher physician to patient population. And as you can see, the dark ones are with definitely higher. And I believe it is no surprise that Russia has the largest number of physicians identified, which is a huge country because they have sizable number of medical schools as well. Okay, and this list shows you a brief synopsis of doctors per 1,000 people or 1,000 population. As you can see, most of the developed countries have at least anywhere from 2 to 4 doctors per 1,000 people. If you take India as an example, we are edging close to that one number, which WHO has recommended, and we are hoping that in the next few years we'll get to that stage. Look at Ghana, look at some of the smaller countries like Zimbabwe, Zambia, and even places like United Kingdom and United States is around 3.2, 3.6 compared to countries like Australia. Now, which is why if you are a medical graduate in India, as we know that many of the medical graduates eventually go outside and practice, and that is a high interest. People go to USA, people go to Canada, Australia. I've seen medical students going to Nigeria, Middle East, and all kinds of places to practice. This is because there's a huge deficit of medical seats and practicing physicians in those countries, and they rely on other countries or workforce from other countries to meet their demand. And that is an existing situation that is quite looming across the world. And taking US as an example, the foreign medical students who join the US workforce are from India, from Philippines. We have some students from Africa, and so on and so on. And by the way, I'm based out of Dallas, Texas, so which is why I can give you a lot of relating information from my US perspective. Now, this is the physician shortage that is expected in the US by 2034. So American Medical Association, which is an organization that provides information or is an umbrella organization of all the medical education programs in America, has projected this that by 2024, this is the expected shortage of physicians in the US, which comes to close to around 110,000 to 120,000 physicians are short in the US in the current scenario. So between 17,800 and 48,000 primary care physicians. Now, when we say primary care physicians, these are typically family medicine or internal medicine practitioners. Between 21,000 and 77,000 non-primary care physicians. Okay. Now, this includes shortages of 15,800 to 30,200 in surgical specialties, which means we will definitely have a shortage of surgeons in the US, and that is nothing new even now. If I'm going for a surgery, unless it is an emergency situation, be it Canada, be it US, you will not get something pretty soon. You have to schedule it based on the intensity, based on the demand, based on the requirement. Your surgery can be scheduled maybe a week down the line, maybe 1 month down the line, depending on the intensity of your situation. And medical specialties also, it's not different. It's around 3,800 to 13,400, and then other specialties. So essentially, what we are saying is America is seeing a significant shortage of physicians in the next few years. Now, before we go to the next slide, I just want to talk briefly about this Caribbean medical education space. Now, this whole Caribbean medical system came into existence because of this scenario from the US. As many of you know, and if you do not know, most of these Caribbean schools are probably an hour and a half or 2.5 hours away from the US mainland. Caribbean is very close to America. It's right off of Florida in most countries. So Americans looked at it as an opportunity to enhance their medical education system by going into this foreign country, which is very close by, which ended up being Caribbean islands, and come back and practice medicine in the US. That is how this entire Caribbean pathway itself started initially. From 1978 and onwards, schools were in existence. And the whole story of Caribbean medical education started with the fact that to meet the demand for a US workforce or US physicians, that is how the Caribbean medical school system itself started to begin with. This is a scenario from Canada. Now, in Canada also, we are expecting by 2028, there's an expected shortage of 43,900 physicians. No different. And Canada has other challenges also because they have a lot of very less medical seats, medical programs in Canada, and which is why we will always see a lot of Canadian students in Caribbean Medical School coming in and taking their education and eventually going back and practicing in Canada. Now, We just talked about briefly about the shortage of physicians in US and Canada, and I also mentioned about how some of these Caribbean schools have been created to cater to this deficit or cater to this demand. We want to focus slightly on how the medical education system works in the US, Canada, and also the Caribbean. It's definitely different from the medical education program that you see in many parts of the world, including India, Africa, and so on. In India, the concept is MBBS, which means after your 12th year of education, you can go directly to the MBBS program. Whereas in this part of the world, it's slightly different. So before you enter into a medical program, after your 12th grade, after your high school, you go to college to take science courses. Many people call it in easy sense, we call it pre-medical, pre-med education. But pre-med education is essentially taking up advanced science courses to support your medical education. So students have to do anywhere from 2 to 4 years of undergraduate education or bachelor's education in college before they can apply for medical school in the US, Canada, and which is a similar situation, Caribbean also. After that, you take up medical school, which runs generally for around 4 years. So initially your undergraduate degree, then you join the medical school, and then we go after that, students are required to do the residency program. Now, this is where there's a slight difference in the US and Indian system. And in India, after your medical school, you get an MBBS degree, and after that, you can do a 1 year internship, and then you can practice medicine as a basic medical practitioner before you join your, unless you want to join and take a postgraduate training. In the US, that is not the case. That is not the opportunity. After your medical school, which is 4 years of medical education, you have to do residency program or your interest. Now, residency is nothing but it is an equivalent of the postgraduate training that is offered in India and many other countries. So the residency program ranges anywhere from 3 to 5 years. For example, after your medical education, if you want to do a family medicine residency, it is 3 years. If you want to do psychiatric residency, 4 years. So depending on the nature of your residency, depending on the program that you're enrolled in, it ranges from 3 to 4 years, or even can even go to 5 years. Now, which means that if you are practicing physician in the US, you would have completed a medical school and you would have taken up postgraduate medical training. Without that, you cannot practice in the US. And this is one significant difference from the Indian and many other countries where MBBS is a system of practice. So if a student is coming from India from MBBS also, before practicing medicine in the US, they have to go through this residency program in the US itself. Without that, they cannot practice medicine in the US. So postgraduate training is built in. It's a component of education. Without that, you cannot practice as a physician in the US, even at a basic level. Now, we talked about the physician shortage that is expected. We talked about Caribbean medical school systems and so on. Now, this slide focuses on how Caribbean medical schools are bridging that gap or identifying the problem. How are we catering towards some of these deficit and problems that is currently available in the US? Now, I think in the previous slide, I talked about residency program. And residency is nothing but it's a postgraduate training, and you have to get into residency program to practice medicine in the US. So getting into residency program is a good indicator of eventual physician practice. So this data shows which students from where got into residency program in the US in 2023. And 2024 residency program approval comes in March, and only then we'll have that data. Now, if you can look at this table on the left-hand side, this chart here talks about residency program currently offered in the US in every year. So in 2023, there were 37,425 residency programs that are offered. Okay. Now, on the slide towards the right, you can see IMG stands for international medical graduates or foreign medical graduates, whatever you want to call it. How foreign medical graduates are meeting the demand or matching into this residency programs. For example, in 2023, 8,388 students who are either foreign medical graduates or IMGs matched into these residency program. So which means almost 20 to 25% of the residency match rate or the physicians practicing currently in the US who will eventually get a license and move on after the residency program are 20% either FMGs or international medical graduates. So that is a huge point to keep in mind when you're exploring an opportunity to study medicine. If you have a US pathway in your mind, if you have a US pathway, think about this. There's an opportunity, but of course, it comes with commitment, effort, and so on. So this slide is probably one of the most important slide in this presentation. How many seats are offered? What is availability for foreign medical graduates? How are foreign medical graduates utilizing it, thereby meeting the demand and fixing the shortage of medical physicians in the US? And in one of my earlier slides, we talked about this, the shortage. Imagine we have a 130,000 physician shortage, and it is growing. The shortage will increase as the population is growing, things are changing, and so on. And there are only 37,000 residency positions offered every year. Now, think about it. How many years it's going to take for this deficit to be fixed? And it's going to increase because every year the population count is increasing in more and more. Now, from this, we talked briefly about the US program, shortage of physicians, US medical education program, and what are your consideration if you're looking at applying or eventually you want to practice medicine in the US? A few key things that you have to keep in mind. Okay, first and foremost, accredited medical school. If you're looking at a Caribbean school to practice, eventually practice medicine in the US, if you're considering Caribbean medical education, always go for a school that is accredited. There are two main accrediting agencies. There is CAMHP and ACCM in the region, in the Caribbean region. So one of the school has to be accredited by one of these entities, and also at least ensure that the accreditation spans to a period of time until which you are in the school. That is one thing that you can keep as a consideration. But many accreditation doesn't run for many years, but at least keep that in mind. You can ask the right questions when you talk to the admissions person from the university. Explore the country and location. One key factor to be considered. Look at the country, safety, life, and all these things you might want to consider when you look at this country. Talk to current students. All the universities will be more than happy, at least many of the good universities will be more than happy to give you contact details of students who are currently enrolled in the program. Now, what I'm trying to say is don't torture the students with phone calls or emails every day, but at least set up an appointment, be nice, be professional, talk to them and get a sense of what the life is all about in that program. Because as you know, students have a lot of things going on in their life, so we don't expect students to be bombarded with phone calls. But when you're very serious, when you think that, okay, now I have to make a decision at that time, talk to the school, get the information of students, and talk to them if possible. The faculty and infrastructure. Most schools, or at least I would say good school who are proud of their faculty, will publish the faculty information on the website. Look at it. Look at it, the qualification of faculty, their background, and ask for information about faculty to their admissions team member. Infrastructure, at least you should have a decent infrastructure in the program that you are going to join. So look at the option, talk about what kind of facilities you have. Labs is critically important. While anatomy is anatomy end of the day in most schools, but facilities what a school offer is what makes it different. And of course, the faculty is going to make a difference. So look at that. You can find a lot of information on the school's website. If not, many schools would have published videos on their campus and infrastructure. And the next one is, it's a no-brainer. See videos, explore websites, etc. Now it's a digital age. You cannot go without proper information, at least unless do an online research. Do a lot of online search, see videos, explore website, reviews, and trust me, some of these reviews can be fake also. Okay, so which is why you have to be very serious in your judgment also. So read reviews, clarify the same questions with existing students, and clarify with admission team also. But if you talk to a student, in most cases, you have a good chance of getting the right information. You as a student will not, in most cases, give you any wrong information to other students. So that is a thing. So if you do all these few or 4 or 5 different things, there's a good thing, a good chance that you will get the right information that you should have in mind to enroll in a medical school in Caribbean of your choice. Clarify a question. This is something that we believe in. I personally believe in this. No question is bad. No question is minimal. Any simple question that you have, ask your admission team member, talk about it again and again and again. If you're not convinced, ask them 5 times, 10 times, ask the question and get information. That's critically important. And affordability is another factor that you can, a critical factor that you can keep in mind. Because if you look at Caribbean as an example for medical education, there are schools that offer a medical education program for $100,000, $60,000, or even going all the way up to $200,000, $230,000. So think about your budget and think about what you get out of it. So, for example, if you can get the same program, same degree, same infrastructure, same accreditation for $100,000 to $125,000, do you really have to spend $200,000, $300,000 to learn from a school? because medicine works on licensability. Okay, to a certain extent, after a certain time, it doesn't matter if you did your MBBS training from this college or that college. End of the day, if you're a physician who is licensed to practice, that is the key weightage that carries, not purely dependent on which university that you graduated from. That's a unique advantage for programs with licensability, especially in the healthcare field. Okay, so now these are this with this section we talk about mostly about the US education system, how the medical education system in the US is working, and then we talk about some of your consideration. Now, I'm not going into too much details of US licensing, USMLE, and so on, which we'll cover in due course of time. In one of our next presentations, we'll talk about what is the licensing procedure in the US, because otherwise it'll be too much information in too short of time, and you might get confused. And we don't want to do that. And as I mentioned during the initial part of the presentation, we'll be having this every month. Join us. We'll try and give you more and more new information at every event. Okay, be a part of this. I just put this slide in because the topic talks about how the Indian system is. So most of you would already know what it is all about. So I'm not going into too much of details with this, but just to give you an idea, your MBBS program runs for 5.5 years. You can join after your 12th grade. There's an internship, which is 1 year. An internship is nothing but you will go through all the main specialties one time and almost practice as a physician during the internship 1 year. And after that, you are free to practice. That is a huge difference from a US or Canadian system of education, where unless you have a postgraduate training, you will not be able to practice medicine. So from Indian system, which is very similar in many other countries, including Africa, Nigeria, and so on, where an MBBS degree, or they call it MBCHB, eventually the program is one and the same, and where after that, after which you can practice. Then in the Indian context, Indian system, you can do postgraduate training, which is a totally separate application process, entirely different, 2 to 3 years, depending on there are diplomas that run for a short period of time, and there are postgraduate programs that run for 3 years. And after that, you can do a super specialty if you are interested. Okay, now this slide talks about more of a consideration that you have to give if you intend to return back to India and practice medicine in your home country in India. National Medical Commission (NMC) has published certain guidelines in 2021, which kind of changed the story for a lot of medical schools or medical students who wants to practice medicine outside, who wants to study medicine in outside of India. So I've just put some of the key points of the guidelines and talk about it a little bit more in detail. Okay, now this lays the first point, which talks about they have to have a medical education program that talks at least about runs at least for 54 months, which means the entire program will run for 54 months. 4 years will not meet the requirement. You should have a program that runs for 54 months. Now, taking Texila as an example, our whole overall program runs for around 5.5 years, which includes a transition semester. So we clearly meet the requirement. Okay. Point number two, undergone an internship for a minimum duration of 12 months in the same foreign medical institution. Now, this is a big challenge for many schools or many universities that offers a training and education outside of India. Universities in China, universities in Ukraine, universities in Russia, and some of these countries. Internship is not an option. Prior to 2021, students had the opportunity to come back to India and do the internship. Now, this is as per this. You should also have the opportunity to complete your internship at the foreign medical institution, which Texila provides. We currently have graduates who are doing interns or even practicing in Guyana for that matter after their graduation. So actually, this month in December is when our internship in Guyana results published, and we have Indian students who have qualified into internship. Received a foreign medical degree with a medium of instruction in English, and that is another critical point. And this point is valid. Point number three, it is valid not only for NMC guidelines. Imagine you are in your clinical training, your clinical education program, and you're taking history of a patient, and the patient cannot speak English at all, which means you will have to have a translator, which is what many countries do. Now, if you ask me, is that the right thing or wrong thing, I'm not going to comment on it. But for the sake of easiness and a rigorous program, ideally, English should be the medium of instruction, especially when you deal with patients and clinicals. If there are English-speaking patients who can relate to you, who you can relate to, your life becomes easier. Otherwise, it's a lot of hard work. Medical education itself is a hard work program. Now, if you have to learn another language in the program, yes, there are a lot of students who do it successfully also. But if you can do this in English, I would say that probably gets one step higher than other programs. So at Texila, at Guyana, interestingly, is an English-speaking country. It's the only English-speaking country in Latin South America. So all the patients and everyone speaks English. Study the mandatory subjects specified in the Schedule 1, which Texila do covers. This is another critically important point, okay? Registered with the respective professional regulatory body or otherwise competent to grant license to practice medicine in the respective jurisdiction of the country in which the medical degree is awarded. Now, this means that students should be registered at the country's medical council where the students got a degree from. Again, talking as an example, I'm taking Texila as an example here. Our students are eligible after internship. They can register in, if they want to practice in Guyana, they can register in the home country and get their certification or be registered with Guyana Medical Council, and eventually, which is a pathway for coming back to India and practicing. And keep in mind, this is only if you consider coming back to India and practice. Okay, if US is your primary opportunity, primary option, which I believe many of you would be, none of these matters. Or these are not consideration. But if you want to back up, if you want to look at India as an option, yes, this is the opportunity. Now, location of medical college or institution or administration of the course or training. Some of the Caribbean medical schools will definitely have this challenge because when you have to do the clinical training outside of the home country. For example, if you're in Antigua, if you're in Curacao, in some of these countries or most other countries, your clinical training is done at a different country, which in most cases will be US or UK. Now, if you eventually intend to go back to India, they are advising not to do that. You have to complete the program of study in the country where the medical university exists. In our case, in Texila American University at Guyana, if you intend to go back to your home country, which is India, and practice medicine, we advise you to study the program and complete the program at GPHC Hospital in Guyana, which is a 650-bed teaching hospital. They have at least around 8 to 9 different postgraduate residency program in the hospital. It's a good place, and our students are well trained who come out of GPHC. Now, with this background, I just want to talk quickly about the Texila program structure. Okay. Now you can see here the students who enroll in the in the 12th grade program, and they study 3 semesters or 2, depending on what is their basic level of education. They study 3 or 2 semesters of advanced science courses. I've termed it pre-med for the ease of understanding, but these are essentially advanced science courses. After that, you do 4 terms of basic science program in Guyana. And if you want to take up US as a pathway, we recommend that you do the clinical science part of the program in US, or you also have the option to do the clinical science part of the program in Guyana also. After the program, you graduate. Now, you can see we have put 2 pieces here. Okay, these 2 pieces are called step 1 and step 2. Step 1 and step 2 is primarily for those students who are looking at doing the rotation in the US and looking at eventually practicing medicine in the US. Step 1 stands for USMLE step 1, which is United States Medical Licensing Examination. And step 2 is for same USMLE step 2. So after the basic science program, basic science is nothing but the theory part of your medicine. It talks about your anatomy, your physiology, your pharmacology, and so on. Essentially, the basic theory part of medicine is basic science. After the basic science, you can take up a USMLE step 1. And then the clinical science is nothing but your hospital training. And during the hospital training, during the final year, or after the hospital training, you can take up USMLE step 2. And then you talk about graduation, and then you can apply for residency program. And eventually, after you complete your residency, then there's physician licensure. Now, there are quite a few moving pieces in this USMLE step 1, step 2, residency, and so on. But that is a totally new session. In one of the next sessions, we'll talk about US licensing, how the residency application works, and how a foreign medical graduate can get into the US residency program and apply and eventually get a physician licensure. And the final licensure in the US is called board certification. So those are all, if you ask me, this chart itself is a 1.5-hour presentation. So we'll talk about that presentation in one of our upcoming events. We'll talk about that in detail. Now, I think we have almost hit the 30 minutes mark. So I think it's time now, and we have another 30 minutes to ask questions. I'll be more than happy to entertain any of your questions. So please feel free. And if you want any clarification, any of the earlier slides, I'll be more than happy to do that also. Okay. How can I apply to TAU? You can go to the website, submit an application, and one of our team members will get in touch with you and provide information on application to the program. Okay. Otherwise, you would have. I'm assuming that you would have attended this event as a part of our invitation from some of our admission team members through a website link. So talk to your admission person. We have admission representatives in India in different parts of the region. Talk to any one of them, and they'll be more than happy to support you with admission information. Okay. So a lot of avenues. You can call us, email us, go to the website, or talk to one of our admissions individual. Next question, can we still practice in US if we do rotations in Guyana? Absolutely yes. You can still practice in US if you do rotations in Guyana, but there's a catch to it, and I want to make sure that we understand this right. So, which is something that we intend to cover in detail in one of the next presentation. So, if you intend to practice in the US and if you apply for a residency program, one factor that makes you a better candidate in the residency program application is your exposure to US clinical setting, and which comes best with you are doing your clinical rotation in the US. So there's nothing stopping you from applying for residency program after taking rotation in Guyana, but we recommend that you complete your clinical training in the US, because you as an applicant looks much better and you have exposed to US clinical system when you have done your rotations in the US. Now, simple examples. I was born and raised in India, and I now live in the US, and I know the difference. These simple things there, in body language, the body space, the space that you maintain between certain individuals. If not the whole concept of clinical training, there are a lot of other attributes that come when you're exposed to US clinical environment, and residency program prefers or would prefer some of these candidates. So if you're US is your pathway, 100% absolutely do your clinical training in the US. Is there an entrance exam for attending TAU? So our application process works on one, your credentials, which is your degree, your GPA, your grades, your percentages, whatever you want to call it, and plus we do an interview. If you're joining the 5-year MD program, there's an interview process for attending TAU. So that is the application process, and one of our admission counselors can give you more information on our application process. Should I be NEET qualified for TAU? Yes, you have to be NEET qualified to join TAU. And there are some exceptions to that rule. Again, if you're not at all considering India as a pathway, there are definitely some exceptions to that rule. So I recommend you to reach out to our admission team members to get more information on NEET and NEET qualifications. Okay, I think there's another question that is relating to admissions. Does the university count internal marks from grade 9 to 12? So in your 12th grade, you should have aggregate marks. We don't look at 9 to 12. We don't take high school GPA as an entirely into consideration. Your 12th grade, 11th and 12th grade is a factor to be considered for admission. Okay. Now I have another question is, are there any specific specialties or areas of medicine that are in high demand either in India or the USA? Now that's a very interesting question. And I'll tell you why. See, from a US perspective, right? We call it primary care. Primary care is primary care or family physicians or whatever you want to call it, is essentially your first doctor that you will see when you have a problem. For example, let's say that I have a chest pain, I have a headache, I have a skin irritation, whatever it is, the first person that you go to is generally a general practitioner who has access to all kinds of information before you go and see a specialist in most cases, which is at least how it happens in the US for the most part. In India, you might go and see the cardiologist directly. So primary care is the first door knock for any patient who has an issue in the US, primary care physician. The largest opportunity is primary care physicians. If you look at the slide that I showed earlier in one of the first slides, where we talked about deficit or shortage of physicians in the US, the largest number of shortages in primary care physicians, which is around 48,000 doctors, are expected as a shortage in the US for primary care physicians alone. So that is a huge demand, huge opportunity. But at the same time, there are certain critical doctors who are in high demand in different parts of the world, which include surgery, neurosurgery, and so on, are at critical demand in different parts of the world. But primary care is definitely one area. Is it possible to give a number on how many students have maxed or passed USMLE? We cannot give a specific number, but I can give you percentages, and these are faculty percentages. USMLE step 1, our passing rate is 90%. USMLE step 2, our passing rate is 94%. Now residency max rate is 80%. Now this information is available on our website also. Okay. If you go to the website at the homepage, this is the first information that you will see. 1994 and 80%. Where can I practice after graduating from TAU? Okay, well, that's a good question. Now, what are the criteria that countries use to allow graduates to practice in their country? Now, India has some specific requirements that we talked about earlier, but what is the general criteria? Okay, now, general criteria is very simple. You should be a recognized medical school in the country where you operate. Number one, your graduates should be eligible to practice medicine in that country where your program operates. And it's again simple logic. If your graduates are not eligible to practice in the home country, how will foreign countries accept their degrees, right? So that's very simple logic. Now, you as a medical seeker, you as somebody who is interested in studying medicine, you cannot go and identify this program from every countries. Okay, so which is why, in partnership with WHO and ECFMG, ECFMG is a body that manages foreign medical students in the US. It's a probably let's call it the NMC equivalent of US is ECFMG. Now, WHO and these organizations together has formed a database called World Directory of Medical Schools. So if you look at those directory, uh, you will get information on your acceptability or you are students eligibility to practice medicine in different parts of the world. So essentially, if you fall into one of these categories, you have your licensing eligibility to license in different parts of the world. There is definitely an opportunity. But with that said, the licensing rules are slightly changing now. For example, for giving one example, one of the criteria that you have to consider if you're practicing medicine in the US is your school has to be accredited. For you to get into residency program, they offer multiple pathways now. And for you to qualify in pathways, your school has to be accredited. So immaterial of your school's name being in the World Director of Medical School list, you have to be accredited. Accredited program has to be there. But as a general, you can say WDMS list and accredited program. These are two key takeaways if you are to practice your program, if you are to practice medicine in different parts of the world. But at the same time, again, as I mentioned in one of my earlier slides, do your research. Certain countries have certain unique requirements. For example, India has specific requirements. If your home country has other requirements, search it and see. But as a general rule, this is a situation. And the US also, I think we have briefly oriented you on US licensing. And as I said, one of our exclusive presentations next will be focused on medical license and practice in the US and how you as a foreign medical graduate can qualify for medical licensing in the US. Our application is still open. Application Texila is still open. Yes, our application is still open. We have two intakes in a year. One is March and one is September. So the March intake is now open, or you can even apply for September, and which is something that I always recommend students. If you are planning on joining a medical school, apply for the program. At least get your options open before you finally decide. So consider at least a couple of options. If you want to consider Texila for September, apply it now itself so that you have at least an option in your hand while you do your research. Education loan is facilities available for me doing MD program in US residency. Okay, well, that's an interesting question and a good question. That is a good time to talk about it. Now, let me explain this in two pieces. Okay, the question talks about residency program. The question I'm assuming is about, do I get a loan while I do my residency program in the US? Okay, now, as I mentioned earlier, the residency program is as good as your postgraduate training in India, as an example. So what happens in residency program is, in residency program, first year, you work as a physician in all the core specialties. Okay. And second year onwards, you work as a physician in your other program of choice, other specialties that you are resident that you apply to and you matched into. Now, here you're working, you're practicing as a physician, you get paid for this. Your first year residency, you get paid around $52,000 to $56,000, depending on which state your residency is in. And second year and third year, it increases. So you don't pay anything while you do your residency program as well. You get paid because you're working as a practicing physician as a part of your residency program. So you get paid actually.
Yes, thank you for the opportunity.
Hi, Gabriel, how are you?
I'm great. Thank you for the presentation. I would like to know if there are opportunities for scholarships in here, and also the prices for the pre-med, the 4-year and the 5-year MD program.
Okay, Gabriel, thank you, and I'm glad that you decided to put a voice to the chat. Actually, our admission team members will email you information on tuition and fees. Okay. Yes, we do have some scholarships available. Very limited scholarships are available for students depending on your academic performance and so on. But I request our admission team members, they are on this call itself. They'll take a note of your contact details and they'll be in touch with you and give you more information, tuition and fees.
Yeah, thank you very much.
Thank you, Gabriel. Okay, I'm going to take another question. Can you please elaborate more on the transition semester? Okay, good. Now, the transition semester, by the definition itself, is transition, right? That's clear. Now, I told you earlier, during the basic science part of the program, you learn about your basic theories and mostly theoretical aspect of medicine, which is anatomy, physiology, biochemistry, pharmacology, all the basic advanced medical science courses. And in your clinical science program, you learn more with an hospital interaction. Now, the transition semester, or let's call it the bridge semester, which it is trying to bridge the gap between this basic science and the clinical science program. Now, that has two components. One, it is a review program that is essentially reviewing whatever you have learned in the basic science and review the program, give you more information, make you prep you best towards your exit exam, which happens at the end of a transition semester, end of the transition semester. So one, it's a review program, and our review program is conducted by Kaplan Medical, which is a leading USMLE review program. Okay, so Kaplan is the one who does our review program. So number one is a review program. Number two is the component that caters you more towards clinical training, which is called ICM, Introduction to Clinical Medicine, where preceptors or faculty from hospitals, they come and train you. They give you basic information, give you more access and more information on bridging a gap towards your clinical skills. So even basic history taking and so on, which is something that you would have covered during your earlier semesters, it's all summarized and finalized during this ICM semester. So it is a bridge program. Now, during the ICM semester, we also give you access to something called as Cyber Patient, and it's an interesting tool. And I wish one of these days we could give you a demo of Cyber Patient. Cyber Patient is actually a virtual patient that a patient will die down, and you can use tools in the system to diagnose a patient, talk to the patient. Patient will cry, it will make different scenarios. It's an interesting tool as a medical student, but most importantly, as a transition semester student, it helps you understand some of the key concepts of clinical medicine using Cyber Patient. So two components. Kaplan, or a review program, or a basic science review program, which is done by Kaplan, then introduction to clinical medicine. Where can I practice medicine after graduating from TAU? As I told earlier, you can practice anywhere in the world as a graduate of TAU. TAU qualifies you for that, but some countries would have specific requirements that you might have to meet. That is something that you will have to find depending on which country you want to practice. We talked briefly about India and USA and Canada. Now you can definitely practice in these countries and even other countries also. Now we have students who are practicing medicine in different parts of the world. Actually, we are quite of a diverse university. We till date we have graduated students from 45 different countries. Now we have students who are practicing in India, in Africa, in Nigeria, in South Africa, in Zambia, in Bhutan, in Bangladesh, even Pakistan. We also recognized by Pakistan Medical and Dental Council. So all kinds of places. So wherever you are from, you should be eligible to practice. But the fine prints of your licensing specific to a certain country, depending on which country you are, you might have to identify, or you can reach out to us. For example, if somebody is to ask us, okay, can Texila graduates practice in South Africa? Absolutely yes, because we are already recognized specifically by HPCN, which is the Health Professions Board in South Africa. So yes, you can practice there also. But most countries you can practice, but specific requirements, you might have to either contact us separately or let us know which country you want to practice or do your own research. Can you give examples of alumni and how well they have done in medical schools? Yes, of course, yes. As I said, we have students who are doing residency in the US. Actually, so if you can ask one of your admission team members to send you copies of some of our prospectus. And at the back of the prospectus, we have given some students success, just a few examples. And there are some of the US residents there. We have students who are practicing in different parts of the world also. You go to a YouTube channel, you'll find a lot of videos and testimonials from some of the graduates who are practicing medicine also. So they practice all over the world, because we are quite a diverse community. We are a huge, diversely populated student body. We have students practicing in different parts of the world, including US and also India, referring to today's presentation. Hi, Sunil, how are you?
Hi, yeah, good evening, sir. I'm fine, sir. Yeah, so I was saying, sir, while doing the step one and step two, can we get any stipend or something like that, scholarship or something while doing step one and step two?
See, when you say doing step one and step two, I am assuming you are referring to preparing for step one and step two, right?
Yeah,
Chances are, to be very honest, chances are very minimal.
okay, okay. So
Okay.
that's the reason
And
because I'm applying for the education loan.
okay.
So to increase that loan or something like that, so to get a initial like stipend, we can show to the guarantor or we can show to the bank that I'm stipend and something like from starting of my education. So it's very
Yeah.
easier to get that what we say the loan and everything from the bank and like this.
No, I understand that. But for during step one and step two, there are
Yeah.
no provisions for a stipend. And again, keep in mind, step
Okay.
one and step two is probably two of the most important exams that you will ever take in your life if you are taking up US as an opportunity. So
Yeah.
maybe that's time, a couple of months during the time is the time that you want to really focus on training. But unfortunately, there's no stipend or anything during that time period.
Fine. Okay. Okay. Thank you. Thank you.
Thank you. Thank you, Sunil.
Thank you.
Okay. If there are no other questions, I think we can wind up today's session. As I mentioned earlier, this is a part of a series of sessions that we'll be continuing. Next month, there'll be another session. And during one of these sessions, we'll focus in detail about US licensing, US practice. So if you know students who are interested in practicing in US, even if they don't want to consider Texila or even if they don't want to consider Caribbean medical education, bring them to the event. We try to make this more informative so that at least there should be some takeaways from this event. So admissions, of course, one part of it. Joining Texila is definitely one part of it. But beyond that, it's about giving information to others. Okay, so your friends, your family, anybody who's interested in joining or want to hear more about foreign medical education, Caribbean education system, US medical education, next events, please, please, please invite them. We'll be more than happy to welcome to this event. Now, with that said, I think it's good. I think you're all at almost 6:30 p.m. in India. For those who have joined from India and others, it might be different parts of the world. So my time, it's 8 a.m. in the morning. So I'm looking forward for my Saturday. So we'll be in touch. Have a good night. Thank you for being a part of this event. Thank you, everyone.
Thank you. Thank you so much, sir.